Good evening, everyone. Welcome to this episode of Heidi Rounds. We're just going to let everyone filter in through the waiting room, and they'll join us shortly. Everyone's filtering in as we go, so we'll just give it 15 to 30 seconds to let everyone in, and then we'll get started. But thanks so much for being here. All right. Looks like everyone's here, so we'll get started. So, welcome to September's issue of Heidi Rounds. We're really excited to be with you this evening. And this month, we're actually going to do something slightly different to what we've been doing in the last few months. For those of you who are joining us for not the first time, where one of the most common questions we get is, am I using Heidi effectively, or am I using Heidi to its full potential? So we thought that we'd spend this hour to really go deep in the demo, from everything from initial setup right through to going through each feature that we use in our practice, and try and answer that question for you so you get a really good sense of what the product can do, and hopefully find some different use cases that you might not have used before throughout the hour. So really excited to take you through that, and hopefully yeah, it'll be a really interesting session. My name is Ben. I'm an emergency doctor by background here in Melbourne, and the clinical director for ANZ. And Phoebe, who's going to join us, I'll let you introduce yourself.
Thanks, Ben. I'm Phoebe. I'm one of the product marketers here at Heidi, and I'm also a registered nurse by background. So super excited to take you through some of our clinical workflows today.
Awesome. So yeah, I'll be playing the role of a GP, but that's kind of interchangeable for any kind of clinic doctor through our demo. And Phoebe will play the role of a clinic nurse, and we'll show you some cool features that you can collaborate with each other as well. So we'll jump into that shortly. We'll then do a Q&A live. So please pop your questions into the Q&A feature. If we can't get to all of them live, we will get back to you as soon as we can at the conclusion of the webinar, and make sure all of those questions get answered. So please just keep sending them through. We'll wrap up just with a note of what conferences we're attending, and yeah, we'll go from there. But let's not delay. Let's get into it. So to start with, I'm gonna play the role of a GP. I'm gonna put a patient who's just returning from hospital after a 2-day admission to ICU. They're a 14-year-old with a new diagnosis of type 1 diabetes, and they've had an episode of DKA. I'll walk you through different parts of the setup as we go, and we'll hit all of the common pain points of a consultation, and show you different Heidi features. Just bear with me while I share my screen. All right, moving on a bit of a glitch here. Need some awkward pause music.
While you're
Right,
getting set up, Ben, I also thought I'd mention if I know we've got a few other different types of clinicians and vets and dentists on the call. So obviously, this is quite a clinically based scenario around a hospital and a GP clinic, but this is all very applicable across different care settings, whether it be for a dog or a dental client.
For any type of patients, that'll work. But all right, we're off and ready. So first thing I want to do is I just want to preface this by saying, before a patient arrives, there's a whole lot we can do with Heidi to kind of help you within the consultation. First thing would be to set up your patient profile. So our patient's name is Tom Freeman. You can see here that you create a new patient, and you'll see this linked patient symbol will appear. So this means that now every time every session I do with this symbol, it'll be the same Tom Freeman. And you can even edit this patient profile, so you can add in some additional patient context. So it's a 14-year-old boy, and his mum's name is Sarah. And you can save those changes. So now if I have multiple sessions across that profile, we'll have that information saved. My first thing that I do whenever I see someone with Heidi is I jump into context and I upload any of the documents that I've read or any relevant information there. So what I'm going to do is I'm going to upload his discharge summary, here from the hospital, but also from ICU. I've got a copy of his emergency assessment, and I've also got an insulin chart, it's a table of insulin and sugar that he's clicked into, that he's filled out for the last couple of days. That final one has a table or document, so I'm just going to tick that it's a complex file, so Heidi can read it, and you're going to see that these will appear down here as they load. Really important, you can drag and drop into context. You can also upload not just PDFs, but Word documents, JPEGs, PNG files, the works. So if you want to screenshot, there are a list of medications from the EMR or free text in here. So this will be like,
while Ben's typing there, it's a really good use case for those who maybe aren't yet integrated yet and use an EMR or a practice management system, and you need to sort of upload files, and you're struggling with the copy and paste and the manual workload. You can just chuck it all into context.
Yeah. And what this is going to do is this is going to kind of catch Heidi up, because I've read this discharge summary. You'll have read a lot, all of the correspondence for each patient. You'll be familiar with who they are. Heidi won't necessarily be, so you can upload all of these documents into context, and it will allow the note will then be kind of generated from what's in context as well as what's in the transcript. I'm just going to kind of demonstrate what you can do with Ask Heidi and context before you even start your session. So you can ask for diagram. So you can ask Heidi to summarize different aspects. Or if you're in a clinic where lots of patients have similar presentations, and you're trying to remember the little details that separate each patient through, you can get Heidi to do that. So it'll quickly generate a nice summary for you that you can read before you bring the patient in, and it will be able to kind of give you not only a summary of the discharge summary here, but even their post-discharge insulin logs, the insulin regime that they've been put in on, discharged on, and different safety plans. Got a GP review scheduled for today, a pediatric endocrinology review in a couple of days' time, and kind of got all of the different long-term surveillance that have been flagged with me in the discharge summary as well. Now that I'm ready to jump into the consultation, let's say I go grab my patient, and we'll get into it, and we'll start the consultation. The first thing I need to do with Tom and his mum Sarah is ask for consent. Now, I've set up the consent pop-up to automatically appear, so when I click Start Transcribe, I'll get this little pop-up. So how I normally ask for consent is I just say to Tom and Sarah, I'm using Heidi, an AI scribe, to help me with my notes and generating all of my letters. It's nice and secure. It's got the same level of security as any kind of cloud-based electronic medical record, and the only person who has access to is me. Would you be happy if I used Heidi in the consultation? And more often than not, they'd say yes. So I can click this. If your clinic gets written consent or gets consent for multiple sessions, you can tick this button as well, so that you don't only get prompted for new patients. You can select that, and then you'll start transcribing.
So Ben, I might just jump in. They've got a really great question from someone.
Yeah, go for it.
They've asked, how would you describe Heidi in layman's terms to a patient who may not be tech savvy, to make them feel confident?
Great question. How I generally describe Heidi is, if you imagine a court reporter or a court typist who's kind of typing away a transcript in a courtroom, Heidi's doing the same thing. It's just typing away the transcript of our conversation, and then it creates notes and things like that for me. So that's generally how I explain it. Most patients are pretty comfortable with that. But open to ideas. If you have other ways you describe it, please add them in as a comment.
Perfect. And I think it's always really important to throw in a little bit of detail around the benefit that it's bringing the patient as well. So you could also just say, this helps me stay really engaged with our conversation, and it means that I'm not always looking at my computer while you're meeting with me, and we can have a really good conversation.
Yeah, the big one is it means I'm not going to be typing the whole way through the conversation. So you kind of pick your audience, but most patients love that. We're just going to upload in this demo today a couple of different pre-recorded consultations just for the interest of time. So just good to flag that we do have this audio capability if you can upload previous consult recordings. I guess the thing to flag is, Heidi, when you're transcribing or dictating, there is no audio file. It's just that written transcript, but we're just trying to expedite the demo, I guess, and save you ignoring us to go through a mock consultation so we can get through more features. So we've finished the consultation. I've clicked stop transcribe, and the note is currently generating now, and we'll see this pop up slowly. And as I review this note for accuracy, we'll give everyone online just a chance to kind of take in the clinical vignette for the patient and the different plan and actions and the like. So I'll just go back up to the top, and I'll just slowly read through it. So 14-year-old post-discharge follow-up for type 1 diabetes. That's good. Admitted with DKA, presented with polyuria, polydipsia, weight loss, abdo pain, vomiting, and lethargy. That was correct. He had a viral illness before. He's had 48 hours in ICU. Followed the DKA protocol in throughout his admission. He's just looking at his history there. That's all accurate. He's had no previous medical conditions other than this. And looking now at his insulin, he's got 15-unit subcut of Lantus, which they haven't, and he's got his Nova Rapid bolus dosing there. That's all good. Some parent paracetamol and the like. He's got social history, his examination findings as we went through in the recording, and that all looks pretty good. Just going through the plan here just to make sure we're not missing anything. Fantastic. That all looks like we've got a good plan. And you'll see here immediately Heidi's picked up from the transcript. There are a whole number of tasks that we need to do that are going to keep us on track throughout this demo. So we'll contact the community diabetes nurse. That's going to be Phoebe. We're going to create a document for the overview of the discussion that we've had today with Tom. We're going to link in Tom with a dietitian, and we're going to refer him to the diabetes nurse educator. So that'll be really helpful. These tasks have been done previously. So the first thing I want to show is just how we can edit a template using Ask Heidi. So say, for instance, that you're noticing here that all these headings aren't really standing out. I'd like them to be bolded. You can ask Heidi to do that for you. So we'll just let that note regenerate. So this is a really great editing trick if, say, for instance, you'd like to have your responses in full sentences rather than dot points. Maybe you'd like it in a letter form rather than in this template, rather than kind of the paragraph list form that you've got. You can prompt Heidi to regenerate that note and replace that note there with bold headings. The other thing to kind of talk to immediately is kind of what scribe settings that we're on. So I'm in the best scribe at the moment for really complex settings. It's great for explaining new diagnoses. If you've got a patient like this one, Tom and his mum, Sarah, who've got lots of questions, feeling really anxious, it'll capture all of that conversation in a great deal of detail. Best is also great for mental health consultations. It'll really capture the nuances of different perseverations and kind of different themes that come up within the consultation. And it will have a little bit more detail in terms of risk factor discussion and risk assessment and the like. Typically for most sessions though, you could get away with just using our fast scribe, so the note will generate a little bit faster. But I'm going to just add a little bit of detail just to kind of show that, but I'm still want to use bullet points just because I can't quite cope with full sentences. So I'll just let the note regenerate. The main reason I'm doing this now is I'm sure many of you have kind of played around with this setting, but we get a lot of questions about, is my template's not working or I'm not capturing the level of detail that I'd like. Sometimes it's not actually a template prompt, it's a detail setting. So I just want to show how you can really fill out the detail and really change the significance of what you get each time. Just by changing that setting. So it's always just got to let that note generate.
I just wanted to call out, there's been a couple of questions of people asking where the context tab is.
Yeah.
I just want to make it clear that context is available to everyone, free users, pro users, enterprise users. And Ben, if you want to just flag it again on the screen.
Yeah, so it's just up here. You'll see you've got your transcript tab, you've got your context tab, and then you've got your note tab, and you've also got context available in the mobile phone app as well. So you'll be able to get it in any app or any whichever platform you're using to access Heidi. So it's just here, just above the template icon, and you'll be able to see it there. So hopefully you'll be able to, hopefully that will help. What I'm going to do now is I'm just going to flick back those settings just to what I had them before. I'm going to let that regenerate, and I'm going to just jump across to my notes here, and I'm going to use some Ask Heidi to complete a few of those tasks. So one of the really great features that we can use Ask Heidi for is, say you've spent a consultation explaining a diagnosis, explaining an operation, explaining kind of the plan moving forward. We all know that it can be a lot for patients, because there's a lot going on and it's a kind of very, very stressful moment. With Ask Heidi, we can create patient explainers or a summary letter, really at the click of the button. So I've just asked Heidi to create a patient explainer a patient explainer appropriate for a 14-year-old level of understanding, explaining diagnosis, management plan, and what to do if they need help for high or low blood sugar levels. The main call out here is this is only going to take anything that we put in context and anything that we've discussed in the transcript. So it's, what you're going to see here is going to generate specifically from that summary. It's not going to come it's not just generating out of an AI database or anything like that. So just to remind or to explain that, because we haven't listened to that kind of longer consultation that we've had with Tom. And we'll see this generate up here. I'll just let it
I've got a really great question, very
go for it.
timely. How can I generate a letter so I'm writing to the patient rather than a referring doctor? So that's an anonymous question, but as you can see, Ben's generated a letter that's actually addressed to the patient just by using Ask Heidi.
So you'll see here, I've got my note, and if I go up to the context tab, there's a new tab here that's appeared with that prompt. So I've got a letter here. If you prefer it not to be a letter and you just want it to be a summary, you can kind of omit that part or change it to a document rather than a letter. And we'll see here that it's summarized the diagnosis, the management plan. The dot points there might not be great, so you might just tidy some things up here, and you can edit this like you can edit your note. And then once you're happy with this, I'm just kind of editing really just for show, but you can go through and edit this document. You can copy it and paste it, or you can send it as an email, print it and export it, and give that directly to the patient. But you'll see that that's a pretty thorough document, which is hopefully going to be super helpful. Another great use case for Ask Heidi is if you're asked to generate a letter that you haven't got a template for. So let's say, for instance, new to this clinic, I haven't written a letter or referral to Phoebe, who's the clinic's diabetes educator. I can just ask Heidi to do it, and it does a pretty fantastic job of generating documents. Obviously, if you're using, writing a certain type of referral letter or care plan or any kind of document regularly, we suggest you build out a template, which we'll show you how to do shortly. But for things that are a little more ad hoc or something you don't do regularly, we'll click New tab here and it will come up here. We'll see that there's a nice referral letter here for Phoebe to access, and you can obviously review that. And that's a little bit more formal. It will use clinical language if you suggest that it's going to a colleague, and you'll be able to kind of review and edit that as you were the previous note. The final use case today is that I want to show just with Ask Heidi is for many of us, we've got patients that have an extended family that speaks languages other than English, or they're multilingual and they want to kind of have something that they can provide the rest of the family. Heidi's not a translation tool, but if you've given a patient explainer in English and your patient speaks multiple languages, or you've got a translator there that's able to kind of review the document and make sure it's okay, you can ask Heidi to create a patient explainer, let's say in this instance for Spanish, that they can share with their wider family to kind of help explain the diagnosis and things like that. So It is available in over 110 languages, so we have quite a broad language capabilities. So if you have a patient that has you know a language other than English, or whatever language you're using as your default consult language, you can use Ask Heidi to generate or a translation of the document for your patients, which can be a really nice touch and be a bit more inclusive. So hopefully that's a nice little feature there. We'll get into templates shortly. I just wanted to quickly go through where you can find tasks and also codes before I hand over to you, Phoebe. So if I go back to my note and I just toggle away from tasks, I can see down here I've got codes. You'll see here that I've got all of the different coding option sets that are available currently in Heidi here. You can select, I'll show you in settings how you can select which ones. But if I click these 10 ICD 10 AM codes and I tick the relevant codes here, probably not relevant. It's not a great wording of the code, but that'll be it. What we'll see is here at the bottom of your note, not your letters, you'll see these codes will be coded here. So you can select the relevant codes, search the relevant codes, and go through that. And they'll be kind of attached to the bottom of your note as a footnote link. In order of where to find these, so if we go into defaults, and you can select whether you want tasks or codes to appear automatically or do not auto open if you don't want. And you can also toggle off tasks if you don't want that. And then there should also be some, I think that's in memory settings. No, it's not, sorry. Just got to find them. There's a defaults. No. Classically can't find the coding set.
Just at the very bottom. They've
Very
moved
bottom.
it recently.
Oh, right.
Sorry, they've
moved it
just
down there. Got
restructured
it.
the settings menu last
Perfect.
week.
Yeah. All right. Awesome. That's great. So you can toggle on the different coding sets there. Perfect. So you can, if you're in the UK, for instance, you can toggle off all of the US and Australian codes, so you can only have 3 coding sets to choose from. The one thing I should say as well, though, is if you go into display controls, this is where the consent pop-up is. So you can toggle that on or off, and that will pop up for every new session as well. So that was something that I discussed before. But what I'm going to do now is I'm going to leave this session alone, and I'm going to hand over to you, Phoebe, who are going to see the same patient on the same day and take over as the diabetes educator in the clinic. So I'll stop sharing.
Thanks,
And I'll let you
Ben.
jump
Just
in.
before I move across, just while it's still relevant, someone's asked, how can I be sure that the translated letter in a different language is accurate? And I think you touched on this.
Yeah, great question. So a couple of different ways. If you've got a patient, if you say the consult's normally in English, for instance, you've got a patient that's bilingual, you can give them an English explainer that you've reviewed and ask them to make sure that the documents are the same in the consult room. Or if you've got a translator there, they should be able to review that. So as I mentioned, not a translation tool, but there are a couple of different strategies that you can use to kind of check that what you're handing them is accurate. And if you've reviewed the note in English and then generate a Spanish translation or another language translation, yeah, that's typically good enough. And we haven't had too many issues reported back from our multilingual clinicians who do that regularly. So hopefully that'll be helpful for you.
Great.
Phoebe,
So
go for it.
over to me. As Ben said, just to paint the picture for you, he is a GP in a clinic that I also work in as a registered nurse. And in this scenario, I'm the diabetes nurse educator who Ben has written the referral letter for our 14-year-old Thomas, who has been discharged with a new diagnosis of diabetes. So what I will do is I'll flick over to my session. And the first thing I wanted to show you before I get started with the actual transcribing was that Heidi has some really excellent collaboration tools. And this is really good for people who are on the practice tier or enterprise tier and work across multidisciplinary teams and different, nursing staff or large clinics. So what you can do with your team is you can see I've got 3 members in my team and Ben is one of them. I can actually access his account and I can see the latest session and appointment he's had with Tom. And what I can do is I can read up on that, get across what the clinical diagnosis was and the history, and before the appointment starts, and I can do a one-click copy and go back to my account. And as Ben went through before, I can start using that context tab to build out that sort of that history and paint that whole clinical scenario before the patient arrives. I can also put in the referral letter that Ben wrote me as well. And as we displayed before, you can put in, tables, images, well, not images, but lots of the different kind of structured formatting around test results and things like that. Another question actually I saw come up in the chat, which is a relevant time to answer this, is this little apply status function up here. So that's also a really good collaborating tool. So if Ben and I were working on a similar document that maybe Ben had to sign off, or what he can do is he can put the session in draft, or if this has worked really well, if for doctors who have admin assistants that are sending out their letters, and you can change the status. So it's a really easy way for you to collaborate with your team members.
What we found was that it was a common issue in really high, fast-paced clinics where maybe you've generated the note, but you haven't had time to review it. You're kind of moving immediately into another room or having a kind of patient kind of come in and out. You wanted a way to flag to your colleagues who might be using that note for context and things like that, if you've not had a chance to review it or not. So it's just an additional communication tool that some people use. If you review your notes kind of before your patient leaves the room or immediately after, it may be less helpful. But if you're coming back to something but your colleague might jump in and use it, this is ultimately what that's for.
Yeah, it's a great safety tool. So my patient's arrived. I will spare you doing the demo, and I'll also upload a free recording session that Ben and I did before the webinar. So just drag and drop.
While you're uploading that and kind of generating that first note, I might just quickly answer a question from David about what you say if the patient asks where my discharge letter is stored, and he's UK based. So all of the information kept in Heidi, if you're in the UK, is stored locally in the UK and private servers there. If you're in Europe, we have servers in Frankfurt, which service all of Europe and also South Africa for our South African users. And then in the States or Canada, if you're joining us from there, there are separate servers in each of those countries respectively that are stored up there. So Heidi will kind of geolocate where you are and store the data there on appropriate servers to make sure that we're compliant. And always good to remember that when it's deleted, it's gone from your Heidi. So you're ultimately in control of how long that we keep that data from. So hope that answered that one for you, David. I'll let you jump back into creating notes. Sorry, Phoebe.
Yeah, no, all good. Great. So just for context, what was discussed in the patient consult, I'll generate just a basic nursing note so we get a good overview of what was discussed in the clinic. This is also a really good way to kind of centralize and anchor all of your information, particularly if you've got like a transcript and you've got a lot of information up in context. It's good to sort of anchor it in the note, because then all of your subsequent documents that are produced in that session will pull from these three tabs. So having this basic detailed note is a great way to sort of have an overview and add any additional information you want to sort of carry through to those other documents that you produce. So as you can see, the patient was between myself and the participant's mother, Sarah, and we just went through the new diagnosis. There was an assessment that took place, went through the BGL logs that were documented by the mother, and they're stable. There was a big education session, which was kind of the predominant purpose of the appointment. So going through reinforcement of insulin doses, administration techniques. There was, management plans around some anxiety around needle phobia and what some like alternative options are around continuous glucose monitoring devices and things like that. And just some observations around family response, and then an overall nursing plan and ongoing follow-ups in the diabetes clinic. So now I've got my central note. I can just document my first note. So what was brought up in the session was a concern around school and what to eat and playing sport. So what I can do is you can see that Heidi's developed a task for me to write the school nurse a letter or an information form around how to manage diabetes in children. Not to say that school nurses don't already have those skills, but it's just sort of like a due diligence. I'm a diabetes nurse educator and I like to equip my patients with those kind of things. So as you can see, Heidi's developing a really nice comprehensive document there. What I'll do is I'll press new tab and that'll bring that document up into its own new tab so then I can keep making edits. So now I want to jump into some really cool tricks and tips around how you can edit your documents after and some shortcuts. Using this little smart dictation, you can dictate directly into a document. So if you've got like a phrase or something that you always want to say, you can just dictate directly into it. Patient and mother were present during the consultation and agree with the plan. Say anything like that. The other thing that I'll just delete that because it doesn't actually make sense for this document. The other thing I want to show you is something called snippets. So basically, for those of you who don't know what snippets are, they've been around in the product for some time, but they're basically like a macro. And for those of you who don't know what a macro are, it's essentially a shortcut which is activated by a / and you can essentially just write, you can save long phrases or text blocks in your Heidi account, and then you can just shortcut them and they'll insert themselves into the document. So I'll show you an example, but just for argument's sake, you know, I might be really happy with what Heidi's produced, but I'm part of a clinic that really values our own sort of local policies around diabetes emergency management. So I've saved the diabetes emergency escalation plan that's produced by my hospital's local health district. And I've saved it as a snippet. So if I just do the / and type in diabetes, I'll see the emergency plan and you'll see it inserts itself directly into my document. Again, I can show you using the dictation key. You can also activate a snippet through dictation. So if I've got a snippet stored in my repository for like diabetes resources for the nurse, I can just, I know the keyword, diabetes in school. And you'll see there the Diabetes in School program, which is actually an Australian-based program developed by the Royal Children's Hospital. But again, it just shows that that voice activation has inserted that large block of text that would take a long time to sort of type out or track down and copy and paste straight into your documents. And I'll jump into settings to show you where they're actually stored and show you how to upload those. Just around my settings. Oh, sorry, I didn't press stop dictating.
So snippets are really great for safety netting if you've got different numbers that you want to kind of provide patients between visits, giving general standard post-procedure advice, or if you're giving, you know, plaster care advice, anything like that. Snippets can be super helpful just to make sure that there's no wiggle room for your output. You make sure you get a really great consistent output each time.
Great. Sorry, I had to do a bit of a refresh. So we're in settings and we're in the memory tab. If you scroll down, you'll see snippets here, and you just simply add a new snippet and you can write your keyword in. It can be whatever you like, and then you can paste the content that you want to be inserted into your documents, and then you can toggle on the verbal trigger or not. Just note that if you do toggle on the verbal trigger and it's picked up in the appointment, it will insert itself into the note. So you probably want to make those verbal triggers pretty, like, yeah, not common terminology that you would use in everyday conversation. And yeah, as you can see, Ben was talking about some really great use cases, like for emergency doctors, for like fast assessments where the observations are all normal, or you're looking at neuro assessments, anything like that. It's really handy. And the last thing I'll just point out, which is something that's only been shipped recently, is you can bulk upload snippets. And that's really great if your organization has like a whole repository of information that you know that you can export into a CSV file. You'll then just be able to upload it directly into Heidi, and you'll have all that information that you can shortcut into your documents.
While you're on the memory tab, Phoebe, I might just talk about what the replace or find and replace feature is, because I can see there's a couple of questions there about how do we get Heidi to use the acronyms I want to use, or I want it to use a specific phrase rather than something else. So you can program all of your common abbreviations that you like using the replace feature as well. So if you've got specific abbreviations, or if you want to, just make sure that Heidi knows exactly what you want to put out, that's a great feature that you can do manually. If you get really specific with kind of regular acronyms that you like to use, and we'll kind of talk through other ways in which you can use. You can use it kind of automatically with personalization shortly as well. But I just thought while we've got on that tab, we'll show that feature now.
Yeah, great. And it's really flexible. You can kind of do whatever you like with it. And you can also do the bulk upload. So very handy. Great. So the final thing I wanted to show you, just from this appointment with Tom, I saw a question come up before around filling forms. I think there was like a government related form that came up in Canada. So what you can do with Heidi is you can upload a PDF form in a structured format, and have that sitting in your template library. And then you can activate those forms in your session, and all the session information from the transcript, the context, and the notes will be used to fill out those forms. And that can be anything from like insurance forms, like screening, ADHD assessments, anything like that. So like hypothetically, my patient Tom might be eligible for pharmaceutical benefit scheme subsidies, or like subsidization for support in community. And I might need to do like a medical assessment for him to be assessed. So I'll previously have uploaded my form into Heidi, and I just scroll down to the PDF templates, so medical history examination form, and Heidi will open a new tab and prepare that PDF. And I've taken the initiative to actually pre-prepare the PDF, because it can take a couple of minutes, but this is what the output generally looks like. So that's this is the US department government form, but this is what was produced when I ran through this session before. So as you can see, it's quite a structured form. It's got pretty complex formatting, lots of tick boxes and boxes, and Heidi's been able to really accurately fill out all that information based on our session. And I've gone through and read it. It's all accurate. Tom's been diagnosed with diabetes. Yeah, you can see the recent hospitalizations at the Royal Melbourne, information about the medical examination that took place. Again, more check boxes. So Heidi will just do that automatically. And it's such a huge time saver for people that we know that get through like 10 to 20 forms a day. If you just upload this once to Heidi, it'll automatically fill those forms out for you. So before I move on, I'll just quickly show you where to upload those forms. So if you go into the templates tab, create new template, you'll see a note or document. So that's your normal templates, or you'll see fill a PDF. And that's where you can drag and drop your PDFs. It is worth noting, you do have to structure those PDFs yourself manually before you upload them into Heidi for Heidi to be able to accurately read them. So I strongly suggest that you click on our formatting guide on the Heidi website. It goes through a really detailed step-by-step process on how to format those PDFs. If you're having trouble, just reach out to our help centre and we can give you a hand in sort of formatting those forms for you.
Fortunately, if you're working in a clinic, your administrative staff will have the ability to upload forms and format forms as well. And you only need to do it once for everyone in your clinic, and you can share forms with each other as well. So hopefully that'll make it a little easier to get up and running.
Yeah,
But the
short-term
support team
long-term.
is here to help if you're struggling with anything to do with forms, because we know how much of an unlock that can be for you.
Yeah.
All right, I might jump back in and I'll jump into templates. and I'll answer a couple of questions that have kind of been popping up, which I think will be good to kind of cover as well. So before I jump into the templates demo, um, a few people have asked about how do I generate reports using Heidi. So the first thing is making sure that all of the collateral information is in context. Now, if I create a new session, for instance, and I want to go back to, you'll see this link session. And when I go into context now, you'll see that I can click previous session. And when clicking that, that means that all of the context and the note from a previous session is automatically going to be dragged into context. Now, I can select up to 3 sessions that will automatically tick. But say, for instance, if you want to make a report on the last, 6 sessions or 10 sessions that you've seen someone, select the 3 most recent sessions, and then you can actually copy and paste the remaining sections into context. And then you'll have all of those sessions available for Heidi to use. If that report's a form that you can fill out a form, as Phoebe's just shown you, you can ask Heidi to create a report using the Ask Heidi chatbot, or if you've got a set template that you use, you can generate that note, and Heidi, with all of that context, Heidi will kind of complete that form as a letter or report for you. So definitely should be using context for report writing, and that's hopefully going to save you a whole heap of time in terms of it'll be able to identify progress over time and things like that that you've addressed, which is really, really great, which is really, really great feature. We'll pop that into draft.
Also, just to confirm, with the forms feature that I just went through, it does need to be a PDF, not a Word document.
Yeah, great. Awesome. PDF is important. All right. And then now I'm going to jump into templates and kind of talk through how to do it. I know we demoed the new template builder last month. There's been a few technical glitches with that, which have delayed its rollout. So some of you might have seen it and seen it go away. The team's working really, really hard on getting that fixed. But we thought it was important to kind of really unlock templates for you all. And the first thing I want to do is when you're going to create a template, the first thing I suggest is always actually jumping onto the community, which you can access through this tab here, or you can click Browse Community in My Templates. Generally speaking, there will be a template for something that you're looking for. So if I look at a care plan, and maybe I want to just for GPs, I can see here I can also filter by location as well. But there are all sorts of care plans here that I can look at and see what I'm there. So if I go into this kind of care plan, it'll give you an example of the note, so you'll see what the end product's going to look like. But underneath it, it's also going to show you the template structure. So if I really like this note, I can add that to my library, and then you can edit this template as your own. Or say, for instance, I really like this section, this first section, but not the rest of it. I can go into the template and I can copy the section that I like, and then add that into a Word document and create my own kind of template that will use a number of different features of templates. So as a starting point to understand what's capable, I definitely have a look at that. One of the questions in the chat was actually about getting multiple issues in a letter as a GP. We know that it's very rare that so a patient will come to you with one issue. I just want to show you how one of our GPs in Australia, Gihan, has managed this. So he's got this mother templates, and you'll see here that in the template, he's got issues 1, 2, and 3, and then it will continue relevant issues 3, 4, 5, etc. only if applicable. So you can actually jump in and codify multiple issues in a template, which is really, really exciting. And the way that I typically suggest doing this is with a template where you've got multiple issues, is trying to talk to your patient early in the consultation, what the issues that they have are and what you want to discuss. And that kind of signposting for Heidi will really help. So say, for instance, I came in and Tom had wanted to talk about his needle phobia, wanted to talk about managing his diabetes and return to sport because he is anxious about that. And maybe he wanted to talk about the potential of getting an insulin pump and CGM because they'd mentioned that in the hospital. Flagging those three things up early and selecting a template with these issues, that will really help, get you the output that you want. But have a look at the template community. There's some incredible examples of what's possible there that you can adapt into your practice. In terms of actually creating a template, if you're like me and you have very, very specific kind of things that you want in an order that you want, click Create Template, click Note or Document. And I always recommend using the Ask Heidi chatbot if you've got a very clear idea of what you'd like. And the reason I say that is it actually allows you to kind of specify very precisely what you want, and Heidi will also, do the bulk of the formatting and work for you. So I've just pasted this prompt in. I would always start by giving Heidi the context of what the note's for. So let's just say hypothetically we want an endocrinology clinic note with the following headings. So we want to start with a single sentence summary of a presentation. You might want to start with, clinic location, face-to-face patient name, whatever it is. Then we go through history, presenting complaint, history, medications, allergies, social history, exam findings with vitals first, investigations, impression, and plan. Before I then generate the note, I'm going to add in anything else to kind of help Heidi get the output I want. So I want to use dot points. If you would prefer full sentences or it to be structured as a letter, include that. I've asked it to include relatives and negatives as well. I want it to omit sections if not mentioned. So for instance, if I don't talk about social history, I don't want there to be a blank tab with social history there. And I'd like it to bold the headings. The more details you can put into the template here, the less editing you'll have to do later. So it is kind of worthwhile just having a think about exactly what you want. And then once you've got that, we'll generate a template here. And we'll see here that it's kind of followed the instructions there with bolded headings, and they're in the order that I want. And it's auto-generated a whole list of prompt instructions here, which is awesome because I never would remember to do all of that myself. Just to explain what all of these different kind of symbols mean. So section headings that you can see here are really just headings so you can break your documents or templates into sections. The square brackets are what we call placeholders, so you can see them here. That's where we're telling Heidi this is the information that I want there in each position. So it helps Heidi organize and synthesize and know what information from the transcript and context you want where. You can get really, really specific. For instance, you could just go patient gender, patient age, or if, say, for instance, you want specific blood test results in a specific order, you can do them in sequential placeholders as well. So that's placeholders. If you want a very specific response, you can use the verbatim quotation mark. So for instance, in allergies, really commonly at the end of this placeholder, I might say, if no allergies, right, in quoting marks, no known drug allergies, close quoting marks. So here we'll see that that's part of the placeholder there, but I've got a verbatim script there. So we'll test that out in the prompt. And then the final thing to know is the rounded black brackets really are about instructions that help Heidi kind of get the output right initially. So for instance, with investigations, I might say prioritize most recent results first. Just so that you kind of, again, trying to give Heidi some extra instructions here. What I'm going to do is I'm going to save this as demo 3 and save it for later. And I'm going to go back into my session with Tom, and we're just going to test this now. Just give it a second to generate. It's always a bit anxious. I just wait for it. But ultimately,
while it's generating, sorry, I've got some more questions.
Go for it.
This is such a common question. So what's the difference between smart dictation and word-for-word dictation, Ben?
Yeah, great question. So smart dictation will remove the ums and ahs, and it will also automatically format your punctuation and and a few other things. So if you want kind of dot points, if you go dot point one X dot point one to Y, it will kind of it'll understand that you're making dot points. It's great for if you're someone like me that hasn't used a lot of dictation in their practice and is not very familiar with dictation. I would generally suggest using smart dictation. If you are very familiar with dictation, have dictated for a very long time, are very comfortable, just use the standard dictation, and that's where you'll have to kind of do all of the punctuation and new lines and formatting yourself as you dictate through. So yeah, smart dictation is, I guess, a little bit of a middle ground between transcribe and traditional dictation, but it's really there designed to help just kind of clean up your outputs and make it a little bit more polished for you. Cool. So then what I typically would suggest is whenever you've got a new template, we'll kind of go through and look, and this looks pretty good. It's followed the allergies prompt there. Well, I don't really love the vitals listed like that. I'd like them all in one single sentence, for example. And let's just say I kind of would love to get rid of that initial setting. So I can go back into the template library, and I'm just going to search for that template again. And you can edit that just here using the edit button. I'm going to delete that because we don't want that there. Going to go down to examination findings. And I'm going to add an instruction.
While Ben's typing, we've got a question in the chat, which is quite relevant.
Go for
it. From Anonymous, when I copy and paste prior provider notes into the template, Heidi creates the note. It writes it as something that was done during our appointment. Is there a way to let it know that it's from the chart review and not the current information? So what I would say there, and Ben, feel free to jump in as well. I think the thing to keep in mind when using Heidi as a large language model is prompt engineering is super important. So whatever instructions you can provide it to give it more context around what you're wanting in the note output, the better. So even if it's you're adding information into context and it's from a previous appointment, it does pay to just add that extra little bit of detail, or make your templates as detailed as possible to instruct it exactly. And you can add in details around past tense, previous tense, not to add in information in certain areas if it's, like for example, you could write patient's clinical history, do not discuss anything that was discussed in today's appointment, only refer to previous medical history discussed in the context. Or you can be quite specific with how you manage timeframes in templates.
Yeah, awesome. I just really wanted to highlight with those quick changes, we've kind of got the changes that we want. So scrolling down to exam findings, you've kind of got them here. And hopefully with a bit of trial and error and not a whole lot of fiddling around, kind of understanding placeholders and instructions and using that Ask Heidi feature with very kind of specific instructions, you'll be able to get things, looking pretty close to what you'd like with only a little bit of back and forth. The only other thing I wanted to flag is if you're, we've got a new feature in beta called Personalizations. And if you have Heidi Labs turned on, so just in settings, go down to Heidi Labs, turn that on. That'll mean you'll get all of our beta features first. What that will do is I'll actually just kind of show, it will learn from the edits that I've made. And it will kind of learn all of the different things that I kind of routinely edit my notes. So as I edit the note output, Heidi will learn and recognize, and it will save me from doing that over and over again with new notes. So what personalizations will do is hopefully it will make your outputs better with less edits over time. And yeah, that's kind of confined just to kind of your stylistic edits and things like that. So you can find that down here just next to, I saw in the chat, there's a few more questions. Just bottom left is tasks and codes. So you'll see I can flick between tasks there, codes, and then personalizations will pop up, and then it will provide evidence for like why this rule has come. And if you disagree with it, just mark that as incorrect. But certainly worthwhile turning on if you want Heidi to kind of get better in time. It's a super helpful feature. Um, the last thing I wanted to just chat about quickly was telehealth. I can see I've lost the question in the Q&A, but there was a question regarding sometimes having mic issues when using telehealth. Um, so the thing to call out if you're using Heidi in your Chrome or web browser and you've got Zoom or Google Meets up or whatever telehealth platform you're using in a web browser as well, there can be instances where they kind of cancel each other out. So they only it won't necessarily record what the patient's saying, but it will pick up what you're saying, and you'll have kind of transcript errors. Um, if you're finding that you're having an issue like that, or you're like it's not working for telehealth, rest assured we have a solution for you. There's a desktop app that we built specifically for telehealth. To download the desktop app, and the only other thing that you need to do to kind of make sure that um, uh, you've got the same microphone set. So you'll just see here in the top corner, you can check um, what mic you're using. You could go to default. And as long as you're using the desktop app and you've got the same microphone selected as your telehealth platform, you'll be able to get both the what you can hear in your ears and also what you say. So that um, hopefully will fix all of your telehealth issues. Please contact our support team if that doesn't fix your problems, because we can also take a look and see if it's another setting or issue in terms of getting that set up right for you. Phoebe, I'm conscious we only have a couple minutes left. Have there been any other questions pop up in that you want me to kind of answer in the last few minutes?
Um, I've been answering them typing, so
Oh, fab.
yeah. I'll just have a quick scroll through. What I'll do is I'll kick you off quickly and I'll reshare my screen so you can
Oh, yeah.
run through some
Yeah.
conferences, and then
Yeah.
if we have 30 seconds at the end, I'll.
Yeah. I could see a few people asking that they've joined late and things like that. This will be available as a recording, so on YouTube. So we'll share that with you in the next day or so. So rest assured it'll all be okay. And yeah, we'll go from there. Maybe a last question just from Howard. He's asked, how can I keep engaging with Heidi as a medical student? And there are going to be internships in the UK soon. Um, we've we've got a lot of medical students showing interest and junior doctors showing interest in Heidi. So keep a lookout for our jobs board. Reach out to me or Phoebe via LinkedIn. We can chat privately as well about different opportunities. We're also working on some med student specific templates that will kind of be prompted so that you can get a little bit of feedback on your examination technique that will come live in the coming weeks. So yeah, there's a lot happening in that space, but yeah, just keep an eye out and don't be shy. Please reach out to us if you have any questions or want to chat about anything, but specifically that later on. Cool. And to wrap up, I guess we just wanted to flag that we're going to be in person at a lot of different events wherever you are in the world. So this is just a list of the conferences that we'll be attending for the next over a month. The team is growing rapidly. We always love seeing our Heidi users in person. So please come and say hello. Tell us what you love. Give us your feature requests. We can help troubleshoot. We can give you a demo in real life and kind of troubleshoot problems for you. So please come and say good day at our booth. We'd love to kind of chat. But we hope this session's been really helpful. We'll be back next month with a product update and a little bit more of a traditional Heidi rounds. But we hope this extended demo has been really helpful. And for those of you who we haven't answered your questions live, rest assured we'll get back to you soon. But thanks so much for attending, and we'll catch you next time.
Thanks.